Back to order. I now recognize Dr. Jackson from Texas for 5 minutes of questions.
Thank you, Mr. Chair. Ms. Weingart, I honestly thank you for coming today. I don't honestly know if I even have a question for you, to be honest with you. I feel like that I don't know what the point is at this particular point. I think most people know what happened at this point. I think anybody that's watched what's gone on for the last few years knows exactly what happened. I'm just going to make a statement. I just want to say that, early on, this is how most people view this. Early on, the data showed that children were unlikely to become infected, spread the infection, become ill, or die from COVID-19. That's a fact. Data also showed that school closures, social distancing, masking, and testing provided no benefit to the students or their adult educators. That's also a fact. Data also showed that those very actions that I just described were highly detrimental to the academic achievement, the mental health, and the physical health of our children. Since the science, the actual science, never supported closing schools, we must examine why and who was behind these detrimental efforts to promote school closures without any scientific support for doing so. We now know that you and your organization, it's been documented at this point, edited the draft of this quote, scientific-based guidance on school reopening from the CDC. The document that was used to keep most public schools all around the country closed, in fact. I don't think you were to blame. I think the Biden White House and the CDC are the ones that really failed our country. The Biden White House and the CDC should have completely disregarded any suggestions from your politically motivated and corrupt organization, in my mind. But I guess, considering your organization gave millions and millions of dollars to Democrat candidates and to their liberal campaign committees, you and your organization got anything you wanted from the Biden administration. That seems to be how it works. This is what corruption in the federal government looks like. The American people have seen it, and they don't like it. Teachers' unions are supposed to exist to protect their members and to advocate for students. However, your organization, the AFT, has demonstrated that what you actually care about is gaining and exerting political influence and lining your pockets with taxpayer money, even if that is at the expense of our own children. Since 2020, Congress has allocated more than $190 billion to schools across the country through the Elementary and Secondary School Emergency Relief Fund to enable schools to stay open. Much of this money has been unaccounted for, and much of it was spent on woke social garbage, racist CRT programs, and other leftist programs. Much of it was provided to increase the salaries of teachers that were paid to stay home thanks to your strong advocacy. So big win for you and big win for the organization. Keep the schools closed. Let people stay home and draw paychecks. Demand money from the Biden administration to reopen schools. Use that money to promote horrible social programs in our schools once they finally reopen. Provide pay increases to your members with federal taxpayer money. And lastly, use the dues from your members to pay off the Democrats that make it all possible. This is what happened. I cannot believe that you still have a job after the role that you and your organization played in the destruction of our children over the last few years. I think it's disgraceful, and I think you should be ashamed of what happened over the last few years, and you should take some responsibility for it. With that, I yield back, Mr. Chair.
Now recognize Dr. McCormick from Georgia for 5 minutes of questions.
Thank you, Mr. Chair. First of all, I want to state that I have great respect for teachers. I mean this sincerely. The most influential people in my life, other than my parents and maybe my Marine buddies, truly appreciate what they've done for me over the years. I spent 4 years as an associate professor, both at private and public schools. I have 7 kids, so I have a little street credibility when it comes to the educational experience, and I've spent about 20 years in youth ministry, so I understand the importance of what teachers do, and I sincerely appreciate the efforts. With that said, I just wanted to go over something that you've already affirmed, which is you had tweeted at one time, what we've seen in public education is that technology can't replace teachers. Remote education didn't work. You did tweet that, correct? Okay, thank you.
Yes, I did.
Thank you. I totally agree with you. My son.
I have tweeted about 200,000 times.
No, I get it.
So
that wasn't controversial. Sorry,
no.
We'll just continue. I'm not trying to corner you, believe it or not. I agree with you. My son actually was having problems during this educational experience where he couldn't get a teacher to meet with him well into the pandemic, where he was remotely learning, but he doesn't do math so well. He's like his dad. And he needed help in person, and even with precautions wasn't allowed to come in. So it really affected his educational experience in a negative way, to the point where he had to drop out of a class. It was It was harmful to him in that educational experience, just like many other students. We've seen it with countless families across the spectrum. We've seen a 5% dip in white students, 13% in African Americans, 8% in Hispanics, a great educational disparity that happened because of this educational experience that we experienced because of COVID. Would you agree that public education is an essential service? Yes or no?
Yes, absolutely.
Thank you. Me too. I was on the front lines of the during this pandemic. I treated thousands of patients. First line from the beginning when we didn't have any vaccinations all the way to December 28th, my last shift. Would you agree that the emergency room doc is also an essential service?
Of course.
Thank you. Me too.
I mean, and sir,
No,
you may not
it's a simple
know.
question. No,
We
I'm not-
represent about 200,000.
I get you. And I
nurses.
represent a lot of ER doctors too,
Yeah,
so I get
and
you.
my sister is
So,
an intensive care
Thank you.
pediatrician.
Thank you for her service.
So I will tell her.
And of course, we couldn't do our job remotely, correct? As ER physicians, correct?
Well, we had over 200,000
I couldn't do my. No, I get you. I get you. but-
nurses who we represent
I get you.
who did not do their jobs remotely.
Right.
And we believed in being in school. That's why I
Yep.
said
No,
earlier.
I get you.
We tried from April.
Same as firefighters, same as law enforcement. Everybody has their jobs that are essential services that they can't do remotely. And as you said, there are people who came in during some scary times that couldn't work remotely. I don't think we're trying to argue about what is essential services. I think we all agree on what those are, whether it be a clerk that actually helps you get your meals or your groceries, or somebody who's serving you in very real ways and required ways. I think we all agree on those things. And I get that it's scary. And I get that at the very beginning there was definitely a reason to be overly concerned because we didn't know how this was going to work. It's a novel virus. I get it. And as we started to develop things, you guys got the wrong information a lot of times. So did we, because it was politicized. And some people who are quote-unquote experts told us things that were wrong, even though they probably hadn't seen patients since the 90s. And people like myself who were seeing thousands of patients were censored, by the way. So you couldn't get the truth a lot of times. So I understand why teachers would be scared to go back to school. I do get that. But as this developed, and as the evidence became more clear, my concern is that we learn from these committees, because that's what we're here for. I don't think anybody disagrees that the whole reason we're here for this committee is so that we don't repeat our mistakes. We have to admit that we made mistakes. We all make mistakes. Doctors made mistakes. We used to not use NSAIDs. We didn't use steroids. We intubated patients. People died because of mistakes we made during a novel coronavirus that we learned from. But would you, as the head of this union, admit that teachers maybe should have gone back to school earlier with retrospective information so we don't make the same mistakes in the future and leave so many kids behind?
Look, I regret COVID. I regret what has happened here.
So I'm just asking a simple question. I want to learn from this, and
No,
I know what you regret, but I have 20 seconds left.
I think you'd be, if you'd let me answer, I think
Sure.
you'd be surprised at my answer.
Okay.
I regret the fear that was there. And part of the reason we wanted clear information was because we had a role in terms of overcoming fear. I think this book that just came out yesterday actually gives us a roadmap for what we need to do going forward, because I do think we didn't get it right. I think the ventilation issues, the testing issues, actually were more important than the social distancing issues. I agree with you. There were things that we really didn't get right.
Gentleman's time has expired. I now recognize Mr. Garcia from California for 5 minutes of questions.
Thank you very much, Mr. Chairman. Thank you, Mr. Weingarten. I appreciate all the work first that you do, that our teachers do across the country. I'm an educator myself. I'm married to an educator, and so I appreciate the hard work. I just want to recenter ourselves and remind us that we went through a massive disruption to our country, to lives. We lost over 1 million Americans. My city alone lost 1,300 residents within my community when I was mayor, just right before I got elected to Congress. This was a traumatic, horrific event and the largest loss of life event of the modern era. And so this idea that there aren't going to be mistakes made in our institutions or organizations, of course, is ridiculous. There are going to be lessons learned, whether it's in our education sector, whether it's in public health, whether it was in the way the government managed on the vaccine rollout. We are going to learn how to make things better. And I want to just uplift the fact that teachers were working under terrible conditions, very situations where they also have family. I want to remember that teachers also have family at home, also have sick parents at home. We're also trying to protect themselves, their loved ones, and their own children outside of the classroom. And so I just want to take that moment that everybody was scared and trying their absolute best. During the pandemic, the Long Beach Unified School District was the largest school district to reopen schools when we reopened because teachers were vaccinated, because we vaccinated teachers early on and got them the supplies that they needed and the resources that they needed.
We often looked at your school district as a model for what to replicate.
Thank you. And a big part of that was because we made the decision early on to double vaccinate all of our teachers and to ensure that everyone had access to the vaccine early. We actually were the first school district, the first city to actually vaccinate teachers in the entire state of California. And vaccination led to reopening schools first and faster. And so there needs to be more emphasis on that vaccine access. I also just want to note, and it's been mentioned a few times, that it was President Trump that was, and his administration that was really facilitating the closures and trying to get us reopened, and it was a total disaster. There was very little support early on from the Trump administration to actually get us support to support our schools. We worked directly with our schools, essentially sidelined the federal government and try to get as much support, whether it was materials, whether it was PPE, whether it was vaccines, directly to our schools. Now, I appreciate you mentioning Long Beach. In fact, President Biden also named Long Beach and our school system as the national model in reopening schools, and we appreciate that. Want to ask you, the American Rescue Plan was a lifesaver, as you know, for schools, for school districts. Beyond the American Rescue Plan, what else should Congress be doing to assist schools to ensure that in the future this doesn't happen again, and that we can reopen schools even faster?
So, several things. Number one, what we learned through the end of this pandemic, and I know that there are some issues in terms of, vaccination or not, but 90% of our members voluntarily vaccinated, and we took a position, and, some people disagreed, and some teachers were fired because of it. We took a position that we needed to work with our members, work with school districts to get as many people vaccinated, our members vaccinated, even on a mandatory basis as possible, to open schools.
And on that point, and I support that, by the way. I think you've made the right decision.
And look, there's someone in this audience here today who disagrees with me about it, And so what I'm saying, though, is that in a pandemic, we need clear information. We need clear guidance. Most of us who are not scientists need to trust the scientists to give us clear guidance and the mitigating circumstances.
Absolutely. And let me
including ventilation and testing.
I agree completely. And vaccine hesitancy, which we know, in fact, members of this very Congress are some of the largest, most vocal vaccine deniers in America. Does that hurt? And would that have hurt the reopening of schools? Did that actually cause any concerns for teachers on the ground?
Well, look, so Dr. Shaw from Rockefeller and I did an op-ed in January of 2021 that said we could reopen schools even without vaccination if we had the testing. And I think during the Omicron variant, we saw that testing really helped us keep schools open, just like it helped the NFL and just like it helped the NBA. And so I think that there's a combination of things that we need to know in terms of what is the measure to keeping people safe.
Absolutely.
And keeping people open.
And finally, I just want to say, if we really want to focus on ensuring, because there will be a future pandemic, ensuring that schools today have the resources that they need,
correct,
that
absolutely.
Teachers have the resources they need, that we're actually reinvesting in our schools, that's actually going to help to ensure that if there's a future pandemic, we can solve it even faster and learn from our mistakes. Thank you so much.
I now recognize Ms. Green from Georgia for 5 minutes of questions.
Thank you, Mr. Chairman. Ms. Weingarten, are you a medical doctor?
I am not.
Are you a mother?
I am a mother by marriage.
By marriage, I see.
And my wife is here with me, so I'm really glad that she's here, Rabbi Sharon Klein.
Ms. Weingarten, and you haven't taught school since the 90s, so you're not a teacher anymore.
I am actually, Representative, I'm actually on leave from my teaching position, and this fall I will be teaching as a guest teacher at Cornell, my alma mater.
When was the last year you taught? 1997, is that correct?
The last time I taught a full class was June 1997.
Okay, that's been quite a long time, approximately 26 years ago. Do you believe in the First Amendment, Ms. Weingarten?
I believe in the Constitution, including the First Amendment, of course.
Oh, great. Well, I'd like to remind you of one of your tweets here where you agreed that my suspension on Twitter, in your own words, politicians shouldn't be exempt from standards about spreading misinformation. Green has repeatedly shown reckless disregard for those standards. This suspension is justified. This is your tweet. Just last year, January 2nd, 2022, I was suspended for my statements about COVID-19 as a member of Congress, by the way. And also, I'd like to point out by the emojis by your name here, it looks like you're more of a political activist than anything. Clearly, unfortunately, you think Ukraine comes before the United States. I'm not sure what the black flex is. I mean, is that digital blackface? But congratulations on graduating from school. But I'd like to
No, it is about honoring black
Ms. Weingarten, I reclaim my time. I didn't ask you a question.
Sorry.
What I'd like to talk about is your recommendations to the CDC as not a medical doctor, not a biological mother, and really not a teacher either. So what you did is you advised the CDC.
Mr. Chairman, that's a
Excuse me, this is my time. You advised the CDC to have schools provide remote work, options for staff that have documented high-risk conditions who are increased risk for severe illness from COVID-19 to limit the risk of workplace exposure, telework, virtual teaching opportunities, modified job responsibilities, environmental modifications, scheduling flexibility, temporary reassignments to different job responsibilities. None of your advice had to do with to stop the spread of COVID-19. It was all about teachers staying home. And there was big results of that. Let me tell you, I am a mother, and all three of my children were directly affected by the school closures, by your recommendations, which is something that you really can't understand. I'd like to point out, let's talk about the real effects of this. Obviously, we know the test results. Oh, and by the way, you celebrating what I had said on Twitter, I had said that children should be in school. I had said the truth, that children were not dying at high rates of COVID-19 like older people were. I had also advocated for our children, not for teachers getting to stay home and kids being forced into virtual schooling. I advocated for the safety of our children and for their education. But you, as a political activist, for the president of the teachers union, we're not advocating for anything good for our kids, and our kids have suffered greatly. As a matter of fact, suicides increased. Their rates of learning went down. And you know what else happened to them? Anxiety, depression, all kinds of problems happened to kids. And then ironically, here's something that was shocking to me, and I'll bring this up to you. You know what else happened? While kids were forced to stay home, and you approve of this, the diagnosis of youths with gender dysphoria surged. This is literally 2020, but yet this is 2021. And this is a problem. This is a major problem. And the direct effect of school closures can be seen here. These are diagnoses of gender dysphoria. And you can see it sharply increased after 20, and 21. It went up. The rates went up. So kids were forced to stay home into so-called virtual learning, where they were spending a lot of time on social media, and all of a sudden we see a direct result of this. And this is a major problem. But the other problem is is you had no business advising the CDC what the medical guidelines were for school closures, because now we have a nation of school children who have suffered because of it. The problem is people like you need to admit that you're just a political activist, not a
Gentlelady's
teacher,
time is-
not a mother, and not a medical doctor.
Gentlelady's time is
I yield.
expired.
Yeah.